Please begin.
All right. We're going to talk about hypercholesterolemia, which means high cholesterol. Now, specifically, which cholesterol we're talking about is the bad cholesterol, because there's good cholesterol and there's bad cholesterol. The bad cholesterol collects all calcium and all different bad products on the walls of the arteries. So it makes the arteries clogged with calcium and bad cholesterol. And the cholesterol, as it goes through your blood, attaches right onto the artery. And slowly but surely over the years, what happens is that the arteries become more and more clogged. When you're a baby, the vessels are very, very clean and smooth without any problems. They move easily. And then as you get older, when you're 10 or 12, you start eating the hot dogs, hamburgers, and pizzas, and the bad cholesterol starts collecting on the arteries. And then as we grow older, in our 20s, some of us start getting a little bit of high blood pressure, pushing from the outside. And then in our 40s and 50s, we have more calcium that attaches to the walls of these cholesterol. Now, when everything attaches tremendously, in our 50s and 60s, all of a sudden we can have a little chest pain. The chest pain comes from the fact that the artery is clogged. The artery being clogged, one of the arteries around the heart, stops the blood from flowing to that part of the heart. That's what we call a heart attack. Now, when it happens in the neck carotid vessels, then that's what we call the stroke. That's why the number 1 and number 2 killers in the whole world still are heart and stroke. So once that happens, you have to get a bypass. A bypass is an operation where they take a vein from your leg and they put it around your heart where the blockage starts to where the blockage ends. So you can prevent all of this by taking omega. You can prevent it by it'll help by cleaning out the vessels. Now what happens first is the good omega comes in, the HDL, which is the good cholesterol, comes in and cleans out the bad cholesterol. And that's in omega 3, 6, and 9, which is what's in omega. Also, the coenzyme Q10 comes in, lowers the blood pressure, and helps with the oxidation. And then the vitamin K2, which is another explosive, important part of omega, comes in and stops the deposition of the calcium inside the vessel, which is important because 60% of the atherosclerotic plaque could be calcium. So by stopping the calcium from depositing on the artery and by the coenzyme Q10 stopping the blood pressure and the omega 3, 6, and 9 by stopping the clogging, by the HDL, the good cholesterol, coming in and cleaning it out, we can prevent the atherosclerosis. The atherosclerosis, of course, is what causes the heart attack, what causes the stroke. Over 34 million people have high cholesterol. When you look at your numbers and your cholesterol numbers, you need to check not only the cholesterol, but the LDL and the HDL. The reason being, if your cholesterol is 200 or lower, it's considered desirable, so it's fine. So if your total cholesterol is 200 or less, it's fine. If it's higher than that, we want to take more supplements to help make sure that we keep the number down. The LDL, the good cholesterol, the LDL is the bad cholesterol. L stands for lethal. LDL is the bad cholesterol. We want it to stay between not above 160. So 160 is the number, 160 or lower for LDL. In HDL, it's 60 or higher because we want it to be higher so it works better. So once again, the total cholesterol should not be higher than 200. The LDL should not be higher than 160. And the HDL, the good cholesterol, we want it higher than 60. These are what we need to help us. Now, I'm going to talk a little bit about the studies that we've done. The omega fish oil is very, very important. The DHEA and EPA are the two types that are very high with us. The coenzyme Q10 also is needed by our heart and liver to help us with the high blood pressure as well. The omega is unique because it has not only the coenzyme Q10, but it also has borage oil and vitamin K2. The borage oil is an anti-inflammatory supplement that also helps you with your joints. The vitamin K2 is crucial because it balances the deposition of calcium, not on the arteries, but goes into the bones and the teeth. Again, heart disease is still the #1 killer around the world, and stroke is #2. Omega results from several studies, including our study, showed that by increasing the omega with the laminine, it's even better for cholesterol and LDL and high blood pressure. The part of the brain that's affected is the hippocampus. And the omega fatty acids make up cell membranes of the brain, nerve cells, and optic nerve. Omega-3, again, is high with DHEA and EPA, which is important for us. Recommended amounts of long-chain omega-3, DHEA, and EPA fatty acids are important. Recommended amounts of them, we need to keep adding more and more. Typical Western diets, only 10% is vitamin K2. So we are very happy that our omega has vitamin K2. And recent studies validate the necessity of vitamin K2. Sources of vitamin K2, summary, beneficial nutrients in omega are not only the coenzyme Q10, but the vitamin K2 as well. So we want us to take omega as part of our nutritional powerhouse, but the omega has to be taken with the laminine. That increases the good part of the omega and makes it work that much better. The digestive helps us with the balance of the good and bad bacteria, and the immune balances our issues with fighting the viruses and the bacteria. So in the end, we want you to take laminine, omega, digestive, and immune, but especially laminine and omega, to decrease the amount of clogging that exists in your vessels. Thank you very much. I really enjoyed our presentation.
Thank you so much, Dr. Andujar. Wonderful information, important information for our heart health. maybe let me ask our partners if anybody has stories, maybe already someone already lowered their bad cholesterol, and you can share this information by clicking on microphone, and I will open your microphone and we can talk. But meanwhile, if it's okay, I would like to share you the story of my father, who already had heart attack back in 2008, 10 years ago, because he never checked his diet. His diet was very poor, and obviously everything what you just said, Dr. Andujar, happened to my own father. Let me share the pictures. They're very scary, so everybody who's very sensitive, don't look at the picture. But that's the real story with which happened with my father. So I think it's important to share the story with many of you. Just a second, I will find the picture of my father right now. I hope I can find it. If not, I will show maybe another time. Hopefully I can find it. My own father.
Your father is very impressive. He did so well for just taking Laminine initially, because the way back when we didn't have all these other products. When he had Laminine, we didn't have Omega. But now that we have Omega, he can take both, which is really good. But he did extremely well initially just on the Laminine, and then now that we have the Omega, he can take both. But it's important to make sure you take them regularly, and it's important that you take them Q12 hours, every 12 hours, in the morning and at night. Because if you just take them in the morning, it'll help you during the day, but then overnight, you'll have problems right back again. So in order for it to work 24 hours, you want to take them in the morning and at night again.
Okay, so on the picture, we can see cholesterol 227 before Omega, and 20 minutes after, we can see the number drops to 167, which is very, very impressive. Here is another picture. Before was 213, the cholesterol, bad cholesterol, and 20 minutes after taking Omega, 143. Let's see another. Young girl. I was really surprised when young people have high cholesterol. And again, everything what you said, Dr. Andujar, in your presentation, as soon as we start to take French fries, pizza, and all other food with preservatives, we see bad numbers, even if we young. So this young lady had cholesterol 193 before, and 20 minutes after, just 20 minutes, 164. And the last picture, we can see cholesterol, the lamb. I don't know, I don't read Indonesian language, but it's obviously, you can see what's happening. 288, 202, and 171, normal. I think it's very impressive. So this is kind of like a proof of everything what you just told us.
Great, great.
Yes.
Any questions? Well, I'll take any questions on any product at any time.
Okay, I can see the first hand, George Tatos. Hello, George. Please introduce yourself, what country you're from, and your question to Dr. Andujar. George? Yes. Hello.
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 No.
Good evening, everybody. To Irene and Mr. Andujar. My name is George Satos from Hungary. My question, I have a patient, I am a naturopath. I have a patient, 5 years old, child, and he has autoimmune disease. My question is, he has some skin disease as well. Can he try to take Laminine and Lamidar Apex as well? And which form and what do you recommend him?
Irene's method worked best. Now let me explain Irene's method. You take the laminine and take it out of the capsule and pour it on the table, and you mix it up with some aloe vera juice, and then you put that on skin areas that are bad. So you do that once a day, and twice a day you do the Lamiderm. I think that is probably the best combination that can help.
Goodbye.
Bye-bye. Irene, you remember your method?
Yes, yes. Actually, I just found a picture of my father. All these pictures some of pictures were taken after his heart attack. You can see that's a picture with prostate cancer, and Papa was constantly at the hospital. And right now, I just want to show everybody very scary picture. What means heart attack? If you don't mind, I can show you. Just okay, look at this. That's the heart attack. In 2008, my father had heart attack. Yes. So so now, as a preventative method, we can use Laminine and Omega plus, and we can stay healthy, guys. Because what happened to my papa, I don't wish anybody to experience that. And I have so many pictures of my papa, who's almost 90 years old right now. And let me even show you the picture. I sent picture to Skype a few minutes ago. That picture was taken, just a second. The picture was taken 2 days ago. I just want you to see what means to be healthy and what means to take all the products Life Farm Global offer to us. So that would be my wish. Everybody, more people on this planet knew about Laminine, Laminine Omega plus, and the rest of our products, because products amazing. All products save life of my own parents, and I'm very proud, and I want to share this information with everybody.
I take 2 pills a day for 3 months, and after that 2 Laminine and 1 the others. For many period of time, I have to take Laminine.
Yes.
And which will be your recommendation for Lyme to prevent get sick again with Lyme?
Well, if it's a sickness that has to do with infection, I would suggest you take much more immune.
Yes.
If it's a sickness that has to do more with digestion, then I would take more digestive. But sounds like you need more immune. And you take the same amount of Laminine and Omega regularly as well. That answer your question?
Yes. And for how long?
Well, you usually need to take things for a period of 3 months to make sure that they work. So 3 months, 90 days is what you need.
I understand that. I told you I take Laminine for a year now, and it's time. I have to pause to have a period without Laminine, or take.
Dr. Andujar, the question is, should he stop taking Laminine or continue to take daily? I'm not Dr. Andujar. I can say what I do. I never stop taking Laminine. For the 6.5 years, every single day, I'm on Laminine and my entire family. Yeah. Okay. I hope we answered your question.
For 6 years as well. For 6 years as well, and I almost never get sick. Before that we had the immune, I would get a cold every so often, but now I never get colds because I take the immune as well. So I would take all 4 products daily. and not stop. Because if you stop, it'll go down, and it may take 3 or 4 months before it gets back up to where it was before.
Thank you.
The
I
level,
understand.
Thank you,
the
Diana.
level that you're taking it at, since you've been taking it for a year, it's at a very high level. If you stop taking it, it'll drop down to 0, and then it may take you 2 or 3 months before it gets back up to where you have it today.
Actually, that's a good point, doctor. That was a very good question, Diana. Thank you so much. I open microphone for Andrzej Nowinsky. Hello, Andrzej. How are you?
Hi, Irene. Hello. How are you? Hello, doctor.
Hello, hello.
Okay, I'll go in a different direction. I don't have questions. I think that all the questions are answered already many times, but I would like to tell you a story of my friend that actually I asked you, doctor, about a few months ago for recommendation. There was a guy, he was taking laminine somehow, you know, some little amounts, and at a certain point he experienced that his eye nerve died. I mean, he stopped seeing immediately, you know, his vision was blurry, and he went to hospital. Nobody could answer the question what happened, but eventually they discovered that there must have been some kind of clogging in the eye nerve, and it partially died. And everybody told him that all they could do is just stop the process, but they cannot do anything to bring back, you know, vision and everything. And they said that he has to stay with this for entire life. After exploring all these options that were available, pretty much nothing was left. He decided to go full on laminine. He asked me to send you a question for recommendation what he got to do, and you recommended him increase the number of laminine, omega, add the omega to it, and curcumin. And that's what he did. He ate, when he came back home, he ate entire package of laminine, like, I don't know, maybe there was 18 or 20 pills left. He ate this the first day. The next day, as soon as he got the product, he started eating about 8 laminines, 2 omegas or 4 omegas, and curcumin and everything. And then later on, he lowered this to 6 laminine and 2 omegas. And what happened after 1 month, he went to doctor. He went to actually 2 doctors to check what's going on. And the first doctor, she said that there's something wrong because all the documentations from hospital was, she said that it has to be somebody else because she doesn't see any problem with the nerve, that it regenerated. And that she cannot explain what happened, but probably he got wrong documentation. He went to another doctor, and this doctor was actually his doctor from the hospital. She was actually, you know, governing his, you know, medications and everything. And he went privately to her clinic, and after she took the test and everything, she said, you know what? She said, I have never seen what I can see now within 30 years of my practice, because your nerve, your eye nerve, is 100% recovered. The vision wasn't clear yet. She explained that it's because maybe there are some partial blood parts, you know, going in the eye, and it might take time before it cleans up. I can tell you that she claimed that the nerve was 100% restored, that she never seen such a thing in her life. As of now, it's actually how much? It's about 4 months, maybe half a year after this accident. and he can see much better. His vision is not 100% clear, but it's about 50 or maybe 60% better than it was before. And actually, you know, this story is a little bit funny because usually when you go to a doctor talks and you listen. And at this moment, after she experienced this, she was listening and he was talking about laminine because she was questioning all the time, what is it? What is it? And tell me more and tell me more. So this is a great story. This story is so unbelievable that the guy has actually problem with promoting laminine because whenever he tells the story, people are in disbelief. They don't believe him because it's too beautiful to be true. So, by the way, which one? And then we have another story shortly. I have one lady. She purchased laminine for, I don't know, maybe 6, 7 years old boy, small boy. He has some kind of problem, neurological problem. So he was a little bit aggressive and this and that. But you know, sepsa. I don't know sepsa. Sepsa is it in English? When you have your blood. I don't know how you call it in English. You know, when there's bacteria in your blood all over the body, how you call it?
Bacteria.
Sepsion? Septemia? Yeah, you know, one of those this problem that I don't know how do you call it in English. Anyway, he got the bacteria in blood in the entire body. So this was very risky situation, and it appeared that probably it was side effect of one of the medications he was given in a hospital. And after a while, they discovered that there was in brain. You know, my English is not that good. He got a stroke, a little stroke, and they noticed all the changes, and you know, they released him from hospital and asked him to come back after 1 month, you know, to see if there's a progress or regress or whatever. And the only thing he was actually given the laminine only. And after 1 month, when he came back to hospital, and they made the resonance, the entire change after the stroke disappeared. And doctors were also amazed how come it could release so quickly after such a short time. So thank you so much, doctor, for recommending, you know, for this advice that you gave to my friend that I talked before, because probably because of laminine, because of your advice and quick response, he's probably he saved his you know, sightseeing, and probably he can enjoy his life better than he used to. So those products, they work.
Thank you for a great
okay. It is great story. It's unbelievable. Probably the only wrong part about this story is that it's too beautiful to tell it to people, because people just don't believe it.
Don't believe it, yeah. Andre, I want to say thank you so much for your stories, because those stories make our webinar so vivid, so great, full of energy and excitement. And I hope we can do more webinars together with Dr. Andujar. We can get knowledge from him, good information, and then we can share the stories, because stories will drive our business. Are we in a beautiful business?
You're welcome.
Yes, yes. Thank you so much, Andre. It was great. Unbelievable stories. Yes. Thank you so much again. I think it's been said a lot, and I just want to say again, thank you to everybody who joined the call, for your questions, for your wonderful stories. And Dr. Andujar, thank you so much for sharing information. Thank you all. Please watch the schedule. We'll do more webinars, and I believe we need to get together more often, because when we're doing webinars, we become much stronger, right? More belief and more results for business. Thank you so much, everybody. Have a great summer.
Thank you.